The Advanced Healthcare Directive Initiative members would like to thank you for watching this pre-session video before your class. Previous attendees have found these stories incredibly impactful, and we wanted to provide a way for you to view them while still using your time efficiently on the day of the class. Our hope is that seeing the stories of these two families will do two things for you. One, we hope you're convinced and agree with us that having the conversation around end-of-life care is critical to your family's future well-being. And two, that you are highly motivated to complete your Advanced Healthcare Directive form and to get it witnessed or notarized as soon as possible. As you watch the stories of these two families, try to imagine the difference having the conversation will make in their lives and for their happiness. These are the things to look at while you're watching the video. The level of confusion, guessing what a loved one would want versus clearly understanding their wishes about the kind of care they want at the end of their life. The level of guilt in the family, feeling like they're making the wrong decision versus less guilt by knowing a loved one's choices. Conflict in the family, disagreement over what to do or what kind of care to give versus having less conflict when there's an agreement beforehand about what kind of care and what level of care that person wants. And the sadness in the family. There's nothing you can do in the moment when someone is in that situation, but the uncertainty can deepen the family sadness versus giving this gift of peace and talking openly about end-of-life care. In the first video, the father or husband has been unresponsive in the hospital for 4 months, having not made the time or actively avoiding the conversation about end-of-life care has put the family in the position of having to guess and make hard decisions about his care.
When it comes to dying, we're not talking enough. Physicians aren't listening enough, and people are suffering needlessly painful deaths. In this program, we'll meet some remarkable people who are confronting death. We've chosen mostly women because the fact is we end up making most of the tough choices for ourselves and for others. Let's visit the Abril family. 4 months ago, Juan Abril had a heart bypass, followed by a severe stroke. Now his kidneys are failing. He's on a respirator. He has a serious infection. His wife has gathered the family at the hospital.
It's been 4 months now that he's been sick in the hospital. To see our father like this suffering is very difficult. We love him so much that we were willing to do anything for him. Tatay! Tatay! Tay! We don't know what to do. We don't know what to do, and we don't know what to do. Just to wait.
There hasn't been any improvement in his condition, and his kidneys are starting to fail. He continues to run fever, so we suspect infection. He hasn't responded to any antibiotics. He's been basically ventilator dependent for over several months, and the pulmonologist has been managing his ventilator and has been talking about possibly stopping the ventilator. And the question is whether that treatment, futile that it may be, is warranted versus allowing him to die, which is probably the inevitable outcome. Well, what I'm going to speak to the family about today is I'm going to talk about options that they have.
Okay. Are you ready to sit down and talk? Okay, why don't we go on down?
Well, it would be easier, ideally, if I knew what he wanted. And unfortunately, I can't talk to him. I have to speak to the family in order to get from them what they feel he would want.
All right. He's been on the ventilator for a long time. His chance of coming off the ventilator by himself,
there's nothing we can do,
is virtually zero.
It's over, right? It's over for him, right? I mean, we cannot give him any more chances that, he's going to live his normal life again. No more.
No. From your father's perspective, what do you think he would want to have done? Say, if he could tell us.
We were not able to ask him about, what he really wanted, in this kind of situation. So, our aspect.
What makes it difficult is because prior to the surgery, my sister and I were very optimistic. But my sister was thinking about creating a living will, but she thought to herself that she didn't want to jinx it. She didn't ask my father to create a living will. My father said that he would endure everything, anything. I had the feeling that he wanted to live.
What I'm thinking is he will not like to live anymore in that kind of situation that he was paralyzed from here to the bottom. I think he will not like to live like that. So
These procedures are all, it's useless. I mean, he's going to die anyway. That's for sure, right?
yes.
And our main concern is not to see him suffer no more. He's going to die anyway. What's the use?
My opinion on that is that I don't want him taken off the ventilator. I want him to die naturally.
Okay, well that's, you already said that that's artificial. There's no way
Yeah, I
wrong
know.
answer to this, okay?
Go
It
ahead.
seems like we're going to be killing him,
If in case that we should have an agreement of taking off the ventilator, we will be burdened by the guilty feelings that, we took it off. It's in our hands right now if he's going to leave or not. So,
We'll talk about it, maybe. We'll talk about it and let you know what will be our decision. Father, I don't know. I really don't know. How will I deal with this situation after he's gone? I don't know what will happen to me. I really don't.
The family in the second video is starting the conversation around end-of-life care early. Try to picture how differently each of these factors will affect the family members after having a clearer understanding about their father or grandfather's healthcare wishes.
Finally tonight, ABC News wants to join you in something right at the heart of the American family. How we can all help the people who care about us make decisions near the end of our lives. And 9 out of 10 of you have told us that we should all be talking about it at all ages, what we want. And yet only a fraction of us have done it. And we know it makes a huge difference in the health of the caregiver as well as those cared for. So ABC News has taken cameras inside a vital, loving family, part of a new community, deciding to have the conversation. This is 85-year-old Norb and his daughter Maureen.
My dad is 85 today. He's still very, very active. He's a wonderful friend.
Throughout life, daughter and father have always talked about everything, except one thing: how to control the end of your life in the same way you control the prime of your life. So dad and daughter gather the family together, 3 generations, for an act of love.
And so now we're just asking that you share some of your thoughts about what you would like at the end of your life, so that we can honor your wishes.
They are part of something new underway for families in America that says having the conversation is a gift parents and children give each other. And there's proof of the difference it makes. Studies show depression rates plummet after a loss if the families have had the conversation. Renowned physician Dr. Atul Gawande says doctors and nurses see it firsthand.
When you're there in that moment and you're talking to the family and you're saying, how much will it bother your father if he ends up this way? And they say, more often than not, I don't know. We never talked about it. That it is incredibly traumatic for the family, for the doctors involved. There's often conflict. It can tear families apart.
So Dr. Gawande has become part of a team led by Pulitzer Prize-winning writer Ellen Goodman. It is called the Conversation Project. It is a kind of guide for families looking for a way to begin.
If we give them a way to talk about it and give people something to hang on to when they're afraid to start this conversation, they can do it and pass it on.
Families like the Jennings. They looked over the conversation guide before they sat down together. First, there's laughter.
My golf swing's still good.
And then Dad directly eases his daughter's guilt and worry about having put their mother in hospice.
I felt like that meant we were giving up on Mom.
She was in a lot of pain, and I think it was handled real well.
And next, Maureen asks her dad for clarity on what he considers a good end to a great life.
So if you were in a condition where you couldn't make decisions for yourself, how extreme would you want us to take measures to save your life versus letting you go?
Well, I think I'm ready to go anytime. You know, I wouldn't prolong anything. I mean, I've lived a great life. Pretty lucky. And because of you guys, you know.
Unexpectedly, a grandson is inspired to speak up about his own wishes for his own life.
That if there was no meaningful communication, that I would want you to stop trying to intervene.
We aren't ready for you to go that soon.
Well, we're not ready for you to go that soon either, so.
One by one, the others weigh in, all ages.
People don't do that.
Happy birthday, dear Grandma.
And with that, another family has joined a kind of estate planning for the heart.
Go!
The conversation beginning in America.
Thank you for taking the time to watch this video. We hope that you're better prepared and resolved to complete your Advanced Healthcare Directive form. We'll see you soon.